All right, welcome back to Live at 9. Of course, it's Wellness Wednesday, and there are many reasons why people start to lose their hair at different ages. So today we have Dr. Quinn with us to explain some of the more common reasons and discuss reasons that can be treated by a medical provider to even reverse or stop hair loss. Good morning, Dr. Quinn.
Good morning.
So what are the most common reasons for hair loss?
Right. So a lot of patients ask me this every single day. If you've noticed, I've grown my hair back, and they say, well, why can't I grow my hair back? And I tell them that there are many reasons, but the most common three include some people have side effects of the medication they're taking. Then number two, some people have nutritional deficiencies, and we're seeing that some now with these weight loss medicines because some people are just not eating anything. But we try to advise them to just eat as balanced a diet as possible and take a multivitamin so they'll get all the minerals they need so that their hair can just be lovely and flowing like mine, like yours, all the people with the beautiful hair. But the third thing and the most common is natural aging process with people who are affected by a genetic predisposition. Maybe their father is bald at the top and their mom's hair is thinning.
Right.
This is the most common reason. And for these, there's not a lot of treatment, but we'll talk about one treatment at the end when we get to that section.
Awesome. And how common is it to start losing hair or experiencing hair loss as you begin to age?
It just depends on the person. Like I said, if they have one of these causes, another cause that I didn't hit on, which I found very fascinating, was stress. Everybody's so stressed right now, and it raises your cortisol levels, and it also raises a lot of other stress hormones that can cause inflammation at the root of the hair follicles and make you lose your hair. So try to keep your stress down as well.
Right. That totally makes sense, Dr. Quinn. Stress affects so much in our health and in our body. So what are some of the common treatments and what exactly is treatable?
Right. So like me personally, I have a genetic predisposition for baldness because every man in my family is bald in the top at my age. But what I started doing is I started taking this medicine called Propecia. It's a very effective medication for male pattern baldness that makes it so that you don't lose the hair. But the trick is you have to start it before you lose the hair. It can't bring it back. And then I started at age 28 when I looked at my dad and my uncles. I said, I don't want that. But I've been taking it the whole time, every day for like 100 years. But the thing is, there are other treatments as well, such as minoxidil. You have the topical, but I take a minoxidil tablet orally, and it works really well. But if you have hair loss for other reasons, look at your family. You might have a genetic predisposition, as I said, but it's not a bad idea to go visit your medical provider so they can run blood tests to make sure that you don't have any type of nutritional deficiencies or any type of hormonal problems such as hypothyroid and just problems with your blood results. But these are things to consider.
Absolutely, Dr. Quinn. And besides the cosmetic part of hair loss, what are some other ways that hair loss can affect people?
Well, like I said, if you're losing your hair, some people they just embrace it. But at the end of the day, if you can keep your hair and that's something that you want personally,
right,
it can make you feel more confident and more young and energetic. But just remember, if you're losing your hair and you're concerned, talk to your medical doctor because there are tests that we can do, such as refer you to a dermatologist, and they sometimes do what's called scalp biopsies and make sure you don't have an underlying cause that could be treated. And sometimes these underlying causes need to be identified because they could lead to other problems.
Right.
So just don't hesitate to talk to your doctor and just inquire, if you're losing your hair, even if you're not concerned, just go get checked out because at the end of the day, it's all about safety.
Right. Yeah. I mean, and being on top of it right before, sooner rather than later, before you lose all your hair. But there are some solutions to this if you are looking to figure this out for your personal experience or maybe for a family member. You can talk to your doctor and there may be some answers for you. But like you mentioned, even if you get those tests done, it could even lead to some more discoveries in your health that could be beneficial as well.
That is correct. But anything that's going on with your body, the earlier you identify it, the earlier it's treated, and 99% of the time, the better the results. It could be the difference between life and death in a lot of cases.